Hello, I'm Dr. John Mira. I'm the plastic surgeon-in-chief at Boston Children's Hospital, and I'm here today to talk to you about cleft lip and palate. This is the most common craniofacial anomaly found in children. Normally, our lips and palates fuse in approximately the 3rd month of gestation. When this doesn't happen, you have what's called a cleft lip or a cleft palate. No one is exactly sure what causes this. There may be some genetic component and there may be some environmental. However, there is no single gene that causes cleft lip and palate. It occurs in approximately 1 in 1,000 births. There are a number of different cleft lip and palate diagnoses, and I'd like to review them with you. The first is a unilateral cleft lip. This is an isolated cleft just of the lip, and it does not involve the palate. In this lower picture, this is a cleft palate. This just involves the palate, and the lip has fused normally. This is a case of a unilateral cleft lip and palate where there's been failure of fusion of both the lip and the palate behind the lip. This diagram shows a bilateral cleft lip, and what you can see here is that both sides of the lip have failed to fuse. So this lateral tissue here and here has not fused with this central portion of the lip. Now this last case is a bilateral cleft lip and palate. So you see here both sides of the lip have failed to fuse, both sides of the palate here in front, and then all the way back into the central portion of the posterior palate. Now, although the initial diagnosis of a cleft lip or palate is concerning, it's important to know that your child is not in pain, and most children with cleft lip and palate will grow up normally and have normal intelligence and do well in school and in society. In children who have cleft lip and palate, one of the things that parents are very concerned about is feeding. In isolated cleft lip, feeding is usually not an issue. In children who have a cleft palate, however, there are some techniques that are required, and for this reason, we have several cleft nurses who have expertise in cleft feeding. On your first visit to our cleft team, we will have one of our nurses work with you and discuss all of the techniques to help you feed your child appropriately. In children who have a cleft lip or palate, dental issues are extremely important. We have a dentist and an orthodontist on our team, and we'll be seeing you on an annual basis. However, it's still important for you to see your pediatric dentist at approximately 12 to 18 months of age for your first dental visit. In addition, it's important to brush your child's teeth twice daily and to avoid foods that are high in sugar. If you have a child with a cleft lip or palate, you can feel very comfortable coming to Boston Children's Hospital. We have a multidisciplinary team, and we treat approximately 150 new cleft children every year. If you have any additional questions, please visit our website or feel free to call us to make an appointment.